Hello everyone, my name is Svetlana Bobkova. I'm a second year master student in biomedical science program. To start with, I'm going to talk briefly about significant importance of my research. So first, drug overdose deaths due to opioids, particularly fentanyl, have dramatically increased over the past 10 years in the United States. Fentanyl is an extremely potent drug that often leads to overdose. It also has a significant risk of addiction, contributing to a large number of people suffering from opioid addiction and overdose-related deaths. So this emphasizes the critical need for research to comprehend the underlying mechanisms of opioid use disorders and investigate potential treatments. So currently, intravenous self-administration models are considered as the gold standard to study opioid addiction in rodents. However, IV model presents challenges such as difficulty in placing catheters in mice and frequent catheter failure, especially during prolonged access to drug. To address these technical issues, a vapor self-administration model for fentanyl delivery can be considered. So Figure 1 provides a visualization for IV and vapor self-administration. On the top, we can see a classical model of IV administration with a catheter in mice. So this model has a number of disadvantages, including one of the main ones that it restricts mice from freely movement. So on the bottom, we can see a graphical presentation of vapor self-administration model where mice is placed in chamber equipped with a vapor. So this picture demonstrates how vapor evaporates steam with drugs, and mice just simply inhales it without any catheters. So what's really interesting about this model is that the vapor itself can be bought at any tobacco shops for a very fair price. So objective of our study was to examine some pharmacodynamic properties of fentanyl after passive administration of fentanyl through vapor in order to determine if vapor self-administration was comparable to intraperitoneal administration. So we used 64 mice, which were divided in six experimental groups and 2 control groups. Fentanyl was administered through IP injections and vapor at equipotent doses. And so the analgesic effect of fentanyl was evaluated using the hot plate test. So methodology of hot plate test is represented on Figure 2. As for results, Figure 3 demonstrates the response on the hot plate test after passive administration and IP injections of fentanyl. We used 3 different doses within each group, but these doses were equipotent between the groups. In passive vapor administration, we can see a rapid analgesic effect after the 5th minute, which leads us to believe that the pharmacodynamics of fentanyl after vapor self-administration resembles IV administration. And as for IP administration, we can see a robust analgesic effect only on the 15th minute after administration. So on Figure 4, we can see the dose response curve, which exhibits a sigmoid pattern, which means that increases doses will lead to increasing effect. So based on this data, we can make a conclusion that vapor self-administration has a rapid onset of action and higher bioavailability of the drug which this also confirms that this model resembles intravenous administration, which is considered as a gold standard to study opioid addiction in rodents. So utilizing the vapor self-administration model represents a promising advancement in the field of substance use disorders research. As for future directions, we are planning to employ a contingent no-spoke model to assess whether mice that self-administer fentanyl under contingent conditions consume similar amounts compared to mice receiving fentanyl passively or via intraperitoneal injections. That's it. Thank you for your attention.